There's been multiple operations between the law enforcement agencies over the last week, specifically focusing on high-risk settings. And then lastly, our communication strategy was one of continuing the central messaging, specifically the risk of transmission in indoor gatherings, and then the localized and decentralized sector-specific messages to complement that. So this is the surveillance and the response update of where we find ourselves. This is our integrated picture, total picture for the province. And what I would like to illustrate to you is the green line on top, and that's what the Premier was talking about, is that we are in uncharted territory in terms of how much oxygen we've been using on a daily basis across the private, public sector hospitals and the military. And I'll reflect a little bit later on that, but that oxygen has gone into uncharted territory of the daily utilization. The second one, the blue line, is our hospitalization, and that is how many people are admitted in both public sector hospitals and private sector hospitals. Then the red line is the reported deaths. And then at the bottom is the yellow line, which is the proportion of the laboratory tests that comes back positive. And that's been a very sensitive marker. And we've been tracking all of these to tell us where exactly we are in terms of the second wave. So just mortality by date of death. We track this very carefully. It's not just on the day that it's reported, but it's actually on the date that the death occurred. And we've been tracking that very successfully and have been comparing that with the Medical Research Council excess death report. So we can be saying that from the death plotting, it's still increasing, but the rate of increase is starting to slow down towards the peak. The reproductive number, which is a province-wide figure for today, just shows you as well that the rate of reproductive number is how many cases every positive case are likely to infect. And you will see that the reproductive number was at the highest towards about the 10th of December, which is about 3 weeks ago. And since then, the number of cases that every positive case infects has been slowly declining. What that means is when it gets to 1, that's when you have a stabilization and a decline. And we can start seeing that the reproductive number in this province is approximating 1. All that means is that the rate of new infections are starting to arrest. It doesn't mean that there is no additional new infections. It's just the rate of it is starting to decrease.
Although Eastern Cape still has capacity